Hugo.
Mr. Gove, it sounds like you and your cabinet colleagues are not going to be automatically tested for coronavirus, despite the fact that the Prime Minister and the Health Secretary have tested positive. Can you confirm that that's the case, that there's no plans to test all of you? And if so, explain exactly why. And can I ask, I think this is probably a question for Dr. Harries. We've heard a lot about the prospect of getting kits that can test for whether or not someone has ever had coronavirus. We're told that 3.5 million of those are on order. Can you clarify, have those kits already been manufactured? And if so, by whom have they been manufactured? What company is producing those? Thanks.
Well, thank you, Hugo. People are tested if they are symptomatic, and those members of the sort of central effort in helping to defeat the virus who do show symptoms are appropriately tested. But I think you can tell from the fact that the three of us are here demonstrates that there are three of us who have not yet demonstrated any symptoms. But it is important, in order, as we mentioned earlier, to try to ensure that we slow the spread of the virus, that everyone, wherever possible, practices the appropriate social distancing disciplines that we've announced earlier. I'll hand over to Jenny and also to Simon just for a final word as well. Jenny.
So actually, I might just add to the points you've just made. So as I said earlier, we have very clear testing criteria. So we would not, in the early phase of the outbreak, we would have strong containment and contact tracing mechanisms. That is not appropriate at this point in the epidemic in the UK, but we will test appropriately for clinical management. The appropriate thing to do if you have symptoms is to self-isolate and remove yourself from the environment so you can't potentially transmit disease to anybody else, and that applies just as much to cabinet members as it does to myself or any other part of the population. The only other criteria would be about the centrality of your role to COVID-19, and it's exactly why Simon has highlighted the importance of testing our workforce and other first responders as well, who are keeping the response going. In relation to the 3.5 million testing, the have you had it as opposed to the have you got it test, they are coming from a variety of different manufacturers, and I think, as Professor Whitty has said before, it is really critical that each of those ones is tested. We test the sensitivity and the specificity of the test, so how frequently we can pick up the disease, and then how sure we are that it's a true positive test. And each of the different types of those testing kits will be evaluated.
Thank you, Jenny. I'm going to leave the last word with Simon. Simon.
Well, I think it's simply to say that, unfortunately, pressure on the NHS is going to intensify over the coming weeks. There's no doubt about that, before things hopefully begin to improve. And so this is going to be a time when a lot of our frontline staff are going to be in highly stressful and pressurised circumstances. But I think what they would want me to say to the rest of the country is know this, that everybody is pulling out all of the stops to do the right thing. And if you can help too, by following the measures that have been set out, staying at home, you will save lives.
Thank you all very much. Thank you.
Okay, Michael Gove there, with some sobering statistics at the beginning of that news conference. And he ended it with Sir Simon Stevens by his side and Jenny Harries, Deputy Chief Medical Officer for England. No Prime Minister, of course, no Chief Medical Officer, and no Health Secretary, because they're all self-isolating. So let's recap some of the main points from that news conference. And with the Prime Minister holed up in number 10, having tested positive for COVID-19, the Cabinet Office Minister, Michael Gove, gave us the latest update on the government's plans to tackle the pandemic. And here are some of the major developments. An alliance has apparently been set up, bringing together businesses, research institutes and universities to increase testing capacity for frontline workers, beginning with critical care A&D staff and GPs. Mr. Gove said that new initiatives will involve antigen testing that will determine whether it's safe for a worker to go back to the front line, and hundreds of tests will be carried out this weekend for NHS and other frontline staff. And Sir Simon Stevens, the head of NHS England, said after changes to hospital structures, 33,000 beds are now available, with new Nightingale hospitals commissioned for Birmingham and Manchester, as well as, of course, at the Excel Centre in London. Now, let's talk to our political correspondent, Jonathan Blake, who's at Westminster Forest. Jonathan, some pointed questions from some of the journalists there about why it might seem in some people's eyes the government potentially wasn't following its own advice, because now we have the Prime Minister, the Chief Medical Officer and the Health Secretary all self-isolating.
Yes, and Michael Gove, in response to those questions, said only that there were procedures in place in government, that ministers and officials were following the guidance around social distancing and working from home when possible. But he did say the fact that the Prime Minister had tested positive for COVID-19 was a reminder that the virus doesn't discriminate, and as he put it, we are all at risk. He did, though, point out that the Prime Minister is still leading the effort against the spread of coronavirus and was chairing this morning's daily meeting of senior government ministers and officials in response to the coronavirus crisis. And he talked about him marshalling the resources of the NHS. So while there were few specifics from Michael Gove on that, I think it was an attempt to remind people that the virus is present everywhere. And now, as we've seen with the Prime Minister, Health Secretary, testing positive for it, very much so at the heart of government. But no talk of a routine testing programme for ministers and officials. Interestingly, on that, he did say, as did Dr. Jenny Harries, the Deputy Chief Medical Officer, that if someone was part of the central effort, as Michael Gove put it, in terms of the government's response to coronavirus, and they were displaying symptoms, then they would be tested. Whereas a normal member of the public wouldn't be in that scenario. They'd simply be required to self-isolate. So a little insight there into how members of the government and officials dealing with this crisis are themselves being dealt with if they show symptoms.
Yeah, Jenny Harris, the Deputy Chief Medical Officer for England, she said that it depended on the centrality of your role to the COVID-19 response. But, as I say, questions, and you've alluded to this, questions about the fact that there isn't going to